A common question people ask is, when do I really need to go for a mental health consultation? Because seeking help for mental health is never something you look forward to doing. If you're thinking you need help, you probably do. The signs and symptoms of mental health illness can vary depending on the disorder, circumstances, and other factors. And in this video, we will present some basic guidelines on when you should seek help. Let's go.
It is important to note that mental health symptoms in its early development can affect a person's emotions, thoughts, and behaviors. However, most diagnoses are made when these symptoms persist for a certain period of time, usually for about 6 months or so before it actually is a diagnosis. That doesn't mean that we should ignore these signs of the development of mental health issues that might come up. The earlier we address these issues, the better our outcome will be in terms of treatment and recovering level of functioning. Some of the common signs and symptoms we can look at for the majority of the disorders that are often problematic in mental health are things like persistent feelings of sadness, confusion, or inability to concentrate on tasks or on things at hand, beginning to have excessive fears or worries or extreme feelings of guilt about things, extreme mood swings, highs and lows, trouble falling asleep, experiencing low energy, low motivation, and significant tiredness that isn't explained by a medical condition, increased isolation having to do with withdrawing from friends or activities. Other symptoms can include detaching from reality, so the person might be delusional, might be thinking things that aren't there, or hearing things that aren't in the environment, or seeing things that aren't in the environment. The inability to cope with just typical daily stressors, trouble understanding and relating to other people in social environments, problems with alcohol and drug use. So if the person is increasing use dramatically or has never drank before but then began drinking or using substances. Any major change in habit, eating too little or too much, is also problematic. Changes in sex drive. For young people, changes in academic performances. Oftentimes people can experience excessive anger or experience or express hostility towards other people or demonstrate violence that is uncharacteristic of them. If they say or express that they have thoughts of hurting themselves or of dying, or that they can't see value in their life, or they're better off gone, those are also statements to be concerned about and to ask the person about. Don't worry about asking them, because asking them does not put the idea in their mind. Asking them allows them to release the idea from their mind and therefore gives you information to be able to help them. Sometimes these symptoms can appear as in physical pain, and so they might experience it in headaches, shoulder or neck pain, or stomach pain, or just chronic fatigue. And so it is important to recognize that these psychological symptoms can be manifested in physical pain. And so if that doesn't get resolved and there's no medical explanation for why that pain exists, it may be that the person has some psychological distress that they can't express.
People think time will heal everything. Is this true? Well, yes and no. Think of it this way: a physical wound requires a combination of appropriate care and attention and time to heal. Without appropriate care, the wound could get infected and cause more pain over time. If it gets bad enough, the person might require an amputation of the infected limb. In order to treat an infected physical wound, you have to uncover all of the false bandage, clean the wound, apply antibiotics, close and dress the wound, and routinely change the dressing. It's very painful at first, but it's necessary for long-term healing. Emotional mental wound is the same way. Without appropriate care, time will only make it worse. What makes it hard for a lot of people is that treatment requires uncovering these old wounds, which can be a painful process, especially if they have been ignoring them for so long. With appropriate diagnosis and treatment, however, people can find relief from their symptoms and discover ways to cope effectively. If the symptoms affect your quality of life and ability to function optimally, seek help. You do not have to just survive. You can thrive and grow even if you have a mental health disorder.
If your loved one shows early signs of mental illness, it is important to have an open and honest discussion with them about what and how you can assist. I once had a person ask me about his nephew's depression. He asked me if I could give his nephew a call. Clearly, I can't do that as a mental health professional, although it is entirely acceptable for him to guide his nephew to scheduling an appointment and then also to be able to attend a first session with the individual, because it does help them express, and it helps you express your concern to the professional who's going to care for them. As we mentioned in our previous videos, being able to talk openly and discuss openly these symptoms and these changes in experiences with your loved one does allow them to feel that comfort and understanding from you. It will be helpful to them to discuss these things, and together you can bring some clarity to the situation and can provide some support that is going to be very needed. This is also significant, and so much more significant if the person has any ideas about hurting themselves or leaving this earth. Those are very serious signs and symptoms that you want to be straightforward about and talk about with the person.
So what does this mean for Christians? Just like it's completely okay for Christians to take medications for high blood pressure, it's completely okay for Christians to see a mental health professional. Unfortunately, due to stigmas, we still hear comments like, Christians shouldn't be sad about this. You're a minister. You shouldn't be struggling with this. Such comments only add shame to the pain. Shame produces secrets, and Satan loves using secrets to his advantage. In Luke chapter 5, Jesus could have healed the leper without touching him, yet he decided to touch him anyway. Jesus didn't just heal the leper from leprosy, he also heals him from shame. As God's children, we do well to imitate him. Please come close, sit down, and listen to other people's pain in order to free them from shame and stigmas.
And that concludes yet another episode of PsyWicV. We hope that the information had been helpful to you. As always, please comment, subscribe, and like our video if you found it helpful. Thank you very much, and we look forward to seeing you very soon.